each ICTHIC Congress is a little bit a good occasion to go back to the history of this group, which since 1970 meets together in different parts of the world. And the subcommittees are the working arm of this group, and have always been a kind of a real workshop and laboratory, traveling laboratory, which has helped us to go further into new concepts, emerging interest in the field of hemostasis and thrombosis. In the 70s and the beginning of the 80s, it was possible to introduce a new subcommittee of the ICTH devoted to an emerging field, which was that of the interactions between the hemostatic system and cancer and metastasis growth. The first meeting was organized on the occasion of the ICTH Congress held in Stockholm, beginning of July 1983, and together with Professor Nemerson from New York, we put together the first meeting. At that time, the main interest to establish interactions between the clotting system and the growth and metastasis of tumors were related to work on the procoagulant activity of tumor cells, or on the development of experimental models of thrombosis in rats, but particularly mice, treated with different antithrombotic agents. And in the years to come, since '83, the interest of this group, which at the beginning gathered maybe 30, 40 people. It was a small subcommittee, let's say, really a working group, became more extended thanks to the fact that our colleagues oncologists became interested in some clinical problems deriving from these interactions, which had been mainly studied at the experimental level so far. And at that time, mainly two issues attracted the interest of our colleagues, and that was the possibility that an occult cancer could be revealed by a so-called idiopathic thrombosis episode that is not in the presence of classical risk factors. And so this was a clinical problem. And the other clinical problem was that thrombosis episodes occurred more frequently in cancer patients and impacted very heavily on the possibility of treatment, for instance surgery, which by itself has a burden of thrombosis risk, and chemotherapy, radiotherapy, and related hormonotherapy, related oncological treatment for oncological disease. Therefore, the problem became of clinical interest, and then, of course, many more people were attracted from hematology oncology units, from internal medicine, and so on. So the subcommittee became more and more clinically oriented, and to go until our times, certainly the part on clinical trials of new antithrombotic agents in cancer patients is maybe one of the more relevant in the development of the program of the Subcommittee on Malignancy and Hemostasis.
And also the International Conference on Thrombosis and Cancer by Anna Falanga stemmed from this activity.
Absolutely. Together with Anna Falanga, we have described a new form of procoagulant activity in cancer cells in the 80s. And this interest has been developed and extended, and Anna has given a lot of contributions also in the field of hematological malignancies and thrombosis. thrombosis, and this conference is really the symbol of how the interest in this field has grown and has attracted different people from all over the world who gather in Bergamo every second year, and it's really a very exciting and high quality meeting we attend with great pleasure.
And also you are involved in a huge study because of the size of the population. It is the Molisani study.
Okay, so let's say that the idea to develop this study came actually from an interest on the common soil between cardiovascular disease and oncological disease, particularly the hormone-dependent tumors, both in men and in women. And the Molisani study is a cohort prospective observational study in the general population randomized from the cities of 30 different towns in Molise, which was started in 2005 and recruited 25,000 adults over 35 years of age, as we know, with no upper limit, till 2010. So in 5 years, we could recruit about 25,000 people who will be followed for, as I said, cardiovascular and oncological events, occurrence of events, of course also total mortality, mortality for different causes, and the intermediate phenotypes which are common to predispose to both cardiovascular and particularly hormone-dependent tumors, that is diabetes, metabolic syndrome, dyslipidemia, and hypertension and related conditions. This study, therefore, stems from an interest on both cardiovascular and oncological, or at least on the common, on the links, as to what we say, and we represent in our slides. It's like two trees which are different but have common roots, or at least part of their roots are common under the earth. So, therefore, we, from the transactional study of Molisani, I mean the first test of the population, we have got very interesting information, for instance, about the value of some biomarkers, biochemical biomarkers in this population, which are predictive of both cancer and cardiovascular mortality. D-dimer is one of these, for instance, which is of interest for both, hemostasis and thrombosis. And the follow-up started in 2010. And we had for 5-6 years kind of regional registries and diagnosis from hospital discharge in the region, which have helped us to follow our population. And now we have the active follow-up, which is to recall the cohort. We have started since a few months, so we get a number of new information, and we have also adapted to that our questionnaire. The participants are answered to two types of questionnaire. One is personal, clinical, familial history, and the other one including drug intake, for instance, all type of therapies. And the other one is a very detailed dietary habits questionnaire. So this has allowed also to correlate a number of biochemical parameters also of hemostatic interest, with parameters such as the adhesion to Mediterranean diet and many other, physical exercise, and a number of those risk factors which have to be considered carefully in a prevention strategy.